Making headlines tonight, Barbados building its resilience to the impact and aftermath of natural disasters. The country is ready in the event of the coronavirus if it occurs. A new system to be deployed in the fight against psychoactive drugs. And coming up in sports, the Windies under-19s all set for tomorrow's start of the Youth World Cup playoffs.
Broadcasting from our studios in the Pine St. Michael, this is CBC Newsnight, starting now.
I'm Shane Jones, leading the news at 7. Barbados must not only prepare for the economic impact of a natural disaster, but also the implications. Minister in the Ministry of Economic Affairs and Investment, Marcia Cadell, stressed this point as she delivered the opening remarks of an Inter-American Development Bank panel discussion. The topic was assessing and addressing the effects of natural disasters, and the event was held at the Courtyard by Marriott. Before the minister spoke, IDB country representative Juan Carlos de la Viñas hinted that government could soon benefit from the introduction of a flagship policy-based loan geared towards sustainable development.
On sustainability, which is going to be the first in the history of the bank. And I think we are very proud of that. It's been a lot of effort and a lot of discussions, and we are hoping to bring this project to the board in a few weeks. And it's going to be a very interesting discussion at the board because we are going to emphasize that it's part of what we can do with a government that is pretty much committed, and we can use all the expertise we have been extracting from many years of working in the region.
Minister Cadell says underinvestment in infrastructure in the last decade, as well as more severe droughts from climate change, have had serious implications for Barbados, forcing government to reorient its priorities.
Water and sanitation now have the biggest draw for us in terms of the public sector investment program. It means that most of where we invest and how we invest is about the climate crisis and is about increasing resilience to natural disaster. It has to be, because it makes no sense to talk about your balance of payments if you do not have a country in which to function, if you do not have citizens who can be productive, if you do not have economic sectors that can continue to thrive.
In stressing that Barbados looks beyond just the immediate impact of a natural disaster, Minister Cadell says government will be embarking on programs to ensure a climate-proof and sustainable Barbados. One of those initiatives is the Roofs to Reefs program.
It is making sure that from the household level, the actual physical infrastructure of people's homes, the way that they interact with natural resources, the availability of the effective water and sanitation infrastructure at the level of the household, at the level of the community, and how that interacts and how we manage issues of runoff and pollution and other things that eventually end up at the level of the reef and at the coast, that the Roofs to Reefs program is addressing all of those issues.
During his presentation on the economic impact of natural disasters, economics principal specialist at the IDB, Eduardo Cavallo, underscored the need for resilience measures to be taken, highlighting that in the Caribbean, there are 3 catastrophic disasters per country per decade. Barbados remains at low risk of getting a case of coronavirus, but its systems are in place in the event that it does. That's the word from health officials after a tour of the infectious diseases building at NMOR this afternoon. Lisa Broom has more.
This multi-room facility here at NMOR can house up to 6 patients if the need arises. It was set up when the Ebola epidemic was at its peak worldwide and retrofitted to deal with the coronavirus. Head of Infection Control at the Queen Elizabeth Hospital, Dr. Corey Ford, is in charge of the unit. He says they were getting their house in order long before the virus reached its present stage. So, for instance, staff have been extensively trained in the necessary protocols and equipment sourced.
You would imagine that if you need extra gloves, gowns, face masks, etc., that there's going to be a run internationally. And Barbados, as a small community, would have more of a challenge in getting these particular things. But I would assure you that we bought everything that was on the ground before the incident hit.
With regards to the ports of entry, Acting Chief Medical Officer Dr. Kenneth George says the surveillance begins as early as on the vessel on which the visitor is arriving.
So we have increased the questions to include China on the automated system and the kiosks, and persons who have visited China, all of those persons should be interviewed. And then we will make a determination if they're at risk or not at risk. If they're not at risk, we will follow them for 14 days. If they're more at risk, what we will do is either decide if they need admission or take the appropriate steps.
And responding to questions about coverage at ports Ferdinand and St. Charles in the north, both Dr. George and Health Minister Lieutenant Colonel Jeffrey Bostic said they will not be left out.
They do not attract the level of business and traffic as certainly the airport and seaport would, but we are not excluding those. It's just that we are focusing on the two major ports of entry at this time, and then we will get to those two, but we are not going to leave them out because obviously that too can be a potential risk.
Only 2 to 3% of the total traffic comes through ports in Charles. We have not forgotten them, but if we were to put our resources, the most likely place that a virus will enter Barbados is through the airport, and then secondly through the seaport in Bridgetown, and then thirdly, way behind, maybe a possibility for ports in charge or ports Ferdinand. But it's not that we haven't forgotten them. If as resources come, we intend to have a prolonged presence up there.
Barbados is not yet in a position to test for the presence of coronavirus, but Dr. George says the Best Dos Santos laboratory, which has the infrastructure in place, has contacted CARFA to determine the cost of the kits needed for the process. Lisa Broom, CBC News.
Meantime, CBC understands that there are Barbadian students attending university in the Chinese city of Wuhan, the epicenter of the coronavirus outbreak. In a release issued late this evening, the Ministry of Foreign Affairs says it has been in contact with those students who are registered with the Barbados Embassy in Beijing. It confirms that those students are in good health and are following the instructions issued by the university authorities. The statement adds that Barbados Ambassador in Beijing, Francois Jackman, is in touch with the students on a daily basis. It says the students have been staying indoors and leaving only to source supplies and are in contact with each other, the embassy, and the Barbadian community in China through messaging apps and social media. As Barbados forges ahead in the fight against new psychoactive drugs, agencies on the front line are being introduced to a new detection system. It's being done through a workshop offered by the Canadian government in partnership with the United Nations and the National Council of Drug Abuse. Aaliyah Briggs reports.
The early warning system will provide electronic data gathering and sharing to enhance the ability of relevant agencies to identify new psychoactive drugs, such as amphetamines and opioids. Minister of Home Affairs Edmund Hinkson says the implementation of this new mechanism will allow for early detection and monitoring of these synthetic drugs.
As soon as a substance is detected, the relevant agencies can determine with speed its composition, its effect, and the likely spread or availability on this island. It is only through maintenance of a system such as this that we can have a fighting chance of mitigating the destructive effects of NPSs.
The new synthetic drugs on the market present a serious danger to public health since they are not locally regulated nor prohibited by international narcotic conventions. However, according to Director of the Barbados Drug Service, Miriam Hines, steps are being taken to change this.
We have been working on how we can improve and how we can update our regulations so that we are not left behind.
According to Canada's High Commissioner to Barbados and the OECS, Marie Legault, the use of synthetic drugs has resulted in a serious health crisis in Canada, negatively impacting the country's life expectancy.
Between 2016 and 18, in 2 years, we had over 13,000 deaths in Canada related to opioid abuse. We had 17,000 hospitalization related to opioid poisoning. And I was talking to Chairman Howell and Troy this morning, and it's unfortunate that Barbados or the region does not have similar statistics because we could compare and basically understand how big this crisis is. For us, it is an unprecedented rate of deaths. This is a major crisis for us in Canada.
A number of law enforcement, customs, and health officials will benefit from the 3-day workshop. It will provide them with the training to identify and manage the effects of new psychoactive drugs. Aaliyah Briggs, CBC News.